Go ahead, ma'am.
Hello viewers, myself Dr. Sujatha Vellanki, Clinical Head and Fertility Specialist at Oasis Fertility, Vijayawada. Today we are going to discuss about secondary infertility. Have you experienced any challenges conceiving again after having a successfully pregnancy in the past? What factors do you think might be contributing to your difficulty in conceiving again? Have you been asked by many of people on when you are going to have other child? So let us look at stop asking moms when they are going to have a second one because we know that it is that painful. How much ever you're trying, you're still having a difficulty in having a conception. This is called as secondary infertility. 1 in 20 couples experience secondary infertility. Secondary infertility is defined as the inability to conceive or carry a baby to term after having a previously successful pregnancy and giving birth. Have you explored all the possible medical reasons for your secondary infertility? And how is your emotional journey been and how is it affecting you on your struggle for having your second child? The first pregnancy was very smooth, comfortable, you didn't have to try much. You had a gap or a time gap in your mind when you wanted to space your pregnancies, and yet this time is getting prolonged and you're not knowing when it is going to happen and when you're going to hear that good news. So today here I am going to tell you about what the secondary infertility is, what are the risk factors, when you might think that you might have the secondary infertility, and when you should be visiting a doctor, and what are the possible causes, and are there any treatment options that are required. So, before we delve in deeper, you need to understand one thing. After the second child, how has your menstrual cycles been? What is the frequency of your intercourse that you've been trying? Is it like when you had your previous pregnancy? What is the status of your tubes? Are there any possibilities that the tubes might have been blocked because of infections during the delivery or during the period where you are trying to recover? And how are your follicles in the ovary? How many eggs are still remaining? And what is your age? So, all these factors can determine your possibility of having a pregnancy. And the most important thing is you will have to be deciding on how sure are you in going for your second child. So, is it like if it comes in a smoother way, you want to continue, or you are prepared to go for more aggressive fertility treatments and you're very, very keen on 100% keen on going for your second child? So, all these factors will decide the chances of having a success in your plan for your second child. As you all know, pregnancy rates are lower and they tend to decrease with an increasing age of female partner and the duration of infertility. So, about the age of 30, only 7% women experience infertility. As the age increases to 35, the chances of infertility are raising to 11%, and by the age of 40, it is increasing to 33%, and by the age of 45, 87% of women are infertile. So, which age are you in right now? 30, 35, or 40? And how long are you married since? There are a few risk factors that you need to look at: pelvic inflammatory diseases, previous history of sexually transmitted infections. Have you developed any instances where you are having repeated urinary tract infections, or repeated vaginal infections, or repeated having white discharge, which is smelling, staining the undergarments? So, these all could be features of infection. And if this is neglected and not taken care of, might spread into the uterus and tubes and cause blockage of the tubes, making it difficult for you to conceive. How are your periods like? With the onset of pregnancy, delivery, postpartum period, women tend to put on weight. Once this weight is not taken care of and they do not go back to their previous pre pregnancy weight, there is a possibility of them developing a polycystic ovarian disease or irregular cycles. So these irregular menstrual cycles, polycystic ovary, PCOS, what we commonly say, tend to have anovulation, and you might miss the timing of ovulation, which might get prolonged once you're getting 35-40 days period. So this is what are your periods regular? So if your periods are irregular, you may be at risk of developing secondary infertility. Any history of previous miscarriages which needed a DNC or a surgical procedure. So infection during the process, if not adequately treated, also might end up in a pelvic inflammatory disease and a tubal block. And if you would have had miscarriages, there could be a possibility of having a change in the quality of the egg or the sperm, which is leading to miscarriage. So you are having difficulty in conception. Any issues with the sperm count? So did you get your semen analysis done? So if your partner's semen analysis was low, so many a times we see like couple who would have had conceived naturally in the first pregnancy, they come back to us, get a semen analysis, and in the report we might see very low sperm counts and sometimes even azoospermia, or what we say as zero sperm count. So there are many factors that can affect the sperm quality after a successful first pregnancy. Be lifestyle changes, onset of smoking, alcohol, sleep deprivation, stress due to work, all these conditions can have an effect on the sperm quality. With increasing age, any onset of medical conditions like thyroid, diabetes, hypertension, all these conditions can have an impact on the sperm quality and the count. Certain medications which are used for the correction of hypertension or diabetes can also have an impact on the semen. So, if you would have had developed any changes in your lifestyle or your medical conditions after your first pregnancy, do get yourself checked for your semen analysis when you're planning the second pregnancy. Hormonal imbalances because of lack of exercise or physical activity and the stress factors could also be a cause of developing secondary infertility. So, if you are planning and trying, so you would have had your first child. Normally, after the first childbirth, we usually recommend to have 1 to 1.5 years of gap before planning the second pregnancy. So once you start, this is the time period which is required for your body to cope up, to regain all the strength that is required during the process of delivery and the breastfeeding. So once you gain all the nutrients back, that is when you can start planning your pregnancy. So once you've regained the energy levels, everything is normal. If you've started trying, within a 1 month of trying, you would be having 38% chances of conception if everything is normal. Tubes are good, periods are regular, husband count is good, there are no issues. You have a chance of 38% getting pregnant in the first month itself. 68% of women conceive in the first 3 months. 81% of them conceive in the first 6 months, and 92% of them conceive within a year. If this is not the norm, and in spite of trying for more than 1 year and you are not conceiving and you find that there is no problem, you have explored the possibilities of having regular periods, regular ovulation, tracking your ovulation, but still not conceiving, that is when you need to visit a doctor. This is because fertility declines with age, and unfortunately, the women's egg does not have a long shelf life, and so you need to plan early if you are looking for a second pregnancy. Do you know that as you age, once the age is more than 35 years, after 2 years of trying, the chances of pregnancy is 45% compared to 85% in women who are less than 35 years of age. So once the age crosses 35, your possibility of having a pregnancy comes down by half. And there is a further decline to 30% if the duration of this pregnancy planning, that is from the first child to the second child, increases by more than 5 years. So let's not wait for that much of long. And your age is more than 35, just 6 months is enough before you see a fertility specialist. So, what are the possible causes that are not identified and that could be a leading cause of why you're unable to conceive for the second pregnancy? Sometimes after the delivery, there could be a changes in the uterine anatomy and the positioning of the uterus. So that sperm which are deposited in the vagina might not be able to reach the ovary in the fallopian tube. There could be some disorders in the transport system in the fallopian tube or some infections which might have dysfunction at the tubal fimbrial end. Even though the egg and sperm meet, if the quality of the egg is not good, they might not fertilize and end up in a fertilization failure. There could be some developmental disturbances in the embryo and could also have an implantation failure because of some polyps or lesions which are present in the uterine cavity as well. So, what are the various causes? We need to look at. Most important thing is age factor, as I've discussed. There could be reduced sperm production because of various reasons, be it lifestyle changes, weight gain, stress levels, lack of activity, or other medications that have been started for other medical conditions like hypertension. There could be damaged tubes, it could be endometriosis, it could be uterine conditions like having small uh, fibroids in the uterus, hormonal imbalances like PCOD, excess weight gain post delivery, and certain medications. There could be some causes in the male factor in terms of stress causing reactive oxidative species and increasing the sperm DNA fragmentation. In the female, the predominant factor though is ovarian aging and poor oocyte quality. We may not have diagnosed proper uterine abnormalities or tubal factors, though we think that the tubes are normal. Endometriosis could be another cause where you might be having difficulty in having a pregnancy. So, what are all the various management options that are present? So, you can look at it's like if you're trying for 1 year, not successful, you will have to visit a fertility doctor and discuss the various management options. You can look at expectant management, like simple taking folic acid medications, lifestyle changes, quitting smoking and alcohol, have some physical activity as a part of your lifestyle. Incorporate exercise into your daily routine. Minimum of at least twice a week, you should have some strength exercises and build your muscle. So once the muscle, you build the muscle, there will be reorganization of the fat, thereby improving the hormonal imbalances. Start to introduce more vigorous activities. Sleep is another important factor which is closely connected to fertility. And getting the right amount of sleep is very important whenever you're doing your support. A minimum of 8 hours of sleep is what we say. Avoid caffeine or coffee intake 4 to 6 hours before going to bedtime. Stop eating for 2 to 3 hours before going to bedtime. Avoid screen time, including televisions, phones, and computers, at least 30 minutes before going to bed. Do some gentle exercises at bedtime or some meditation. Check and look at what diet are you taking. Have good healthy fats in the diet so that your hormones are in balance. Take the prescribed medications like the folic acid prenatals, vitamin D, and coenzyme Q10. You can discuss options of going for ovarian stimulation and IUI if you feel that the sperm motility is an issue and possibility of low sperm count. However, sperm IUI can fail if the sperm count is very low or there are differences in tubal, ciliary motility, fertilization failure, poor egg quality, faulty endometrial lining, and advanced maternal age. So when an IUI is not working out or is not an ideal scenario, that is where we go for a laparoscopy and advanced sperm function test. So whether you should go for an IUI or an IVF, here, the fact depends on, as I was telling you, the chances and the fact is like you already have a child. So, when you're having a child, how keen are you and how sure are you and how aggressive are you in going for a second child? What is your desire? What is your urgency? And is it like you're really motivated to have your second child? So, if that is a process, then are you okay to go for more aggressive treatments like IUI or IVF, which are having the highest success rate and where you can go for in a shorter duration of time, you can complete this journey of having a second pregnancy. So we have various options like IVF and ICSI treatment methods. You need to go for a basic before an IVF assessment of the cavity. keep your hormones under control, improve the egg quality, improve the sperm function, use antioxidants and vitamin D for some amount of time before proceeding for the IVF. If age is a factor, or if you had previous miscarriages, or there is an issue with the sperm factor, consider going for pre-genetic testing of embryos, because as age increases, the genetical abnormalities of the babies increase, and we do not want to have a negative pregnancy test or a miscarriage. So that is where the PGTA helps. So, what are the treatment options that are available? You can go for expectant management, change in lifestyle, diet changes, weight reduction, physical activity. Consider IUI for 3 cycles, and if the reserve is good, up to 6 cycles. The average reserve is good and the age is below 35, we can try up to 3 cycles of IUI. If the age is more than 35 years, IVF is a better option. But if no treatments for last 2 cycles or never used any medications, consider 1 or 2 cycles of IUI. So whether to go for an IUI or an IVF or just stick on to the natural process depends on what is your duration of fertility, what is your age, and what are the egg reserve or the follicles that are left behind for you. For example, the scan shows a good follicular count. You can consider 6 cycles of IUI. But if the AFC is between 15 to 24 cycles of IUI, if it is between 10 to 15, 3 cycles. If the AFC is less than 10 on both the ovaries, you may have to consider IVF. And this is where the couple needs to sit together and take their step towards taking control of this fertility journey, and how are they going to go about if at all they need an IVF procedure. Seek support always from healthcare professionals who specialize in infertility and reproductive health. Envision a future where you feel confident and hopeful, knowing that you are taking the proactive steps towards expanding your family. So, if you have any doubts on this particular situation, feel free to contact us and we are happy to assist you. So, be happy and content, and believe that the positivity attracts positivity. So when you want to get pregnant, your life must reflect the joy of having the baby, and everyone is unique and everyone responds in a different space. Don't be overwhelmed looking at friends or family members who are having a second child and you don't feel that you are left behind. Everyone responds in a different way. So it is always better to take time and be calm and composed when you're planning for your second child. So do you have any questions or queries regarding this? I'll be happy to assist you. How long should we wait to get pregnant with a second child? So, whenever you are planning for a second pregnancy, it is ideal to wait for at least 1.5 years for the body to heal from the process of the delivery or the journey that has taken place during the first pregnancy. So, to improve your blood levels, to improve your bone strength, to see that the reproductive organs come back to the normal levels, get regular menstrual cycles, all these take at least about more than a week. So this 1 year we encourage exclusive breastfeeding of the first child, and it is always better to wait for 1 to 1.5 years after the first pregnancy. So sometimes, if at all it is a normal delivery, you might plan it after 1 year. But if it is a cesarean delivery, we need to plan after 18 months or 1.5 years. What is the prime age to have a second baby? It is always ideal. The best time to have pregnancy is around 26, 27 years. So complete your journey. If at all you want to decide on and you have decided on going for a second child, complete this journey within 1.5 years from the first journey. So within 30 years of age. As age increases, the chances of success rate of treatments or chances of you having a baby will come down drastically. How do you treat secondary infertility? So, Secondary infertility, the major chunk of treatment, 85% of chances of success in secondary infertility lies with expectant management. Changes in your lifestyle, reduction in stress factors, improvement of sleep pattern, go for a pro-fertility diet, and all these options will help in clearing the and treating secondary infertility in 85% of the cases. 15% of them who don't conceive with expectant management or changes made, or who might have developed a tubal factor, an infection, pelvic inflammatory disease, endometriosis, PCOD, any of the conditions, those conditions will be treated appropriately. Where there are issues with sperm motility, we can consider going for an IUI, and if the wife's reserve is good and the AMH is good, you can try for ovulation induction with intrauterine insemination of the sperm sample up to even 6 months if all things are good. However, if the age is more than 35 or the reserve is on the lower side, you might want to move for an IVF treatment at the earliest, looking at the success rates of IVF as a fertility treatment. How successful is IVF for secondary infertility? IVF treatment offers the same amount of success rate as that of primary infertility, provided you start early. The earlier you start your IVF or fertility treatments before the age of 30, the chances of success are good. As you age forward and you reach 40 years of age, there are chances of having a success with the IVF in secondary infertility, which accounts to about 10 to 15% after the age has crossed 40. So you need to plan early, complete the journey before 30 or 35 years of age. So your chances of success would be pretty much higher. What are the reasons for unsuccessful IUI? So whenever you're looking at an unsuccessful IUI when trying for a second pregnancy, most possible reasons that we are looking at is that you are there any changes in the sperm parameters or the semen analysis? Are there any weight changes or the weight put on by the female partner is on the higher side, resulting in more eggs being lost? So if you are looking at giving a good reserve, good sperm motility, good count, the possibilities of them having a success is very good. Even up to 4 to 6 cycles of IUI can be tried, and if there are any issues during the cycle monitoring, that can be addressed there itself. Are there any symptoms of secondary infertility? So most of the times there will be no features of secondary infertility unless you have an underlying problem. Like there is a PCOD, you might have irregular periods, acanthosis nigricans, increased facial hair, obesity, all these problems. If there is an endometriosis, they might have pain during the periods, which was not there previously or the first childbirth. So these are the symptoms which are pertaining to that organic condition. The possibilities of infection, they might have symptoms of having urinary tract infection, lower abdominal pain, etc. So sometimes, even though there are no symptoms, you should not be delaying your pregnancy, thinking that everything is fine. Just visit a doctor, take an opinion from an expert fertility specialist, see that if there is any tubal problems or any reduction in the ovarian reserve, that might need to take action at the earliest so that you can prevent these possibilities of having secondary infertility. So this is what we have today on secondary infertility. If you have any further questions, feel free to ask us by connecting on to the helpline described below, 7825850116. I hope you like this session. If you need more content related to fertility issues, please do mention in the comment box, and I will be happy to come on live with you again some in the next week. Thank you.